Understanding chronic bronchitis, a persistent respiratory condition. Chronic bronchitis is a long-term lung condition. It makes breathing difficult. It happens when the airways in your lungs become inflamed. This inflammation is persistent, meaning it doesn't go away easily. Chronic bronchitis is a serious condition, but with proper management, its impact can be controlled. Chronic bronchitis falls under a broader category of lung diseases called COPD, or chronic obstructive pulmonary disease. COPD is a group of lung diseases that block airflow and make breathing difficult. Early diagnosis and treatment are crucial for managing chronic bronchitis and preventing further lung damage. Inside the airways, how chronic bronchitis develops. Imagine the airways in your lungs as delicate tubes that carry air in and out. In chronic bronchitis, these tubes get irritated and inflamed. This irritation is often caused by long-term exposure to irritants like cigarette smoke. The inflammation causes the airways to swell and produce more mucus. This mucus is thicker than normal, making it hard to clear. As the condition progresses, the walls of the airways thicken, further narrowing the passage for air. This narrowing makes it harder to breathe, leading to symptoms like coughing and shortness of breath. Over time, the air sacs in the lungs can also get damaged, making it even more difficult to get enough oxygen. The smoking gun, a major culprit in chronic bronchitis. Smoking is the primary cause of chronic bronchitis. The harmful chemicals in cigarette smoke irritate the delicate lining of the airways. This irritation triggers inflammation and excess mucus production. Over time, this repeated damage leads to the development of chronic bronchitis. While smoking is the most significant risk factor, other irritants can also contribute to chronic bronchitis. These include air pollution, dust, and fumes from chemicals. If you smoke and are exposed to these irritants, your risk of developing chronic bronchitis is even higher. Section 4. The telltale cough, a hallmark symptom. The most common symptom of chronic bronchitis is a persistent cough. This cough usually produces thick, discolored mucus. You may experience this cough daily, and it often worsens in the morning or during the winter months. Other symptoms of chronic bronchitis include shortness of breath, wheezing, chest tightness, and fatigue. These symptoms can vary in severity from person to person. If you experience a persistent cough or any of these symptoms, it's essential to see a doctor for diagnosis and treatment. Section 5. Chronic bronchitis versus other COPD conditions. Chronic bronchitis is one of the two main forms of COPD, the other being emphysema. While both conditions make breathing difficult, they affect the lungs differently. Chronic bronchitis primarily affects the airways, causing inflammation and mucus buildup. Emphysema, on the other hand, damages the air sacs in the lungs, making them less efficient at exchanging oxygen and carbon dioxide. It's important to get a proper diagnosis from a doctor to determine the specific type of COPD you may have. This will help guide treatment decisions and ensure you receive the most effective care. Early diagnosis and treatment are crucial for managing COPD and maintaining the best possible lung function.